Hi everyone, my name is Fumilayo Makonjola. Welcome to Share Care program. This is what we do in this program. We'll call different medical professionals and they will talk on different health topics for you people to learn. There is some health challenges that is happening, that is occurring in the world now. At least you will have knowledge on it. And don't forget, I used to tell you always, try to follow me on Facebook, on TikTok. And today also my guest is here. Good morning, sir.
Good morning. Thank you
Thank
for having
you.
me.
Thank you for coming on this program. The normal way we used to do in this program, you will greet my viewers, you will tell them your name and your profession and the topic that you want to enlighten us on.
All right. Thank you so much for having me once again. My name is Dr. Ayuba Adamu. I'm a medical officer and I'm here to talk about infertility in women, largely.
Thank you so much. What do you want to tell us about the infertility in women? Can you briefly explain to us so that we'll know the meaning of infertility?
Okay. Infertility medically is defined as inability of couples to conceive after 1 year of regular unprotected sexual intercourse. So what that means is it is better to start investigating or getting worried about couples becoming infertile after at least 1 year of being together. So by that definition, it already lessen the anxiety of trying to worry. Some couples will get
Yes,
married and
by
within
6 months
6 months
they will just be
or 3
complaining.
months they'll be complaining of not conceiving.
Yes.
So
Even the family. Even the family, I'll be worrying them. What happened now? Why you people have not conceived? We don't even see anything again after the marriage.
so the definition is very important.
Okay.
Yes. So that is what infertility largely means. And it can be categorized into two.
Okay.
We have primary and secondary infertility. Primary infertility is when either of the couples have never conceived before. No history of conception in the past.
Between them, but
Yeah, either between them or
outside the marriage, before they get married.
Yes. So, but secondary infertility is when there was history of conception, but now they are getting it difficult to conceive. So that is the difference between primary and secondary infertility.
Okay, what can actually cause this infertility in women? Because we base on the woman now. What can cause the infertility in women?
Okay. There are different or many causes of infertility as it relates to the women. By the way, let me mention that generally speaking, women contribute like 35% of the causes of infertility as a whole.
Okay.
And men do the same, 35%. While there are 20% causes that are related to both of them.
Okay, that means we cannot shift the blame on the woman alone.
Of course. So that is why it is necessary for, if we are talking about couples, both of them need to be evaluated.
Okay.
Yes. So, but there is a 10% factors which are not known. That makes 100%. 35% from each, while 20% for both of them, and 10%
that is unknown. Okay.
You understand? Very important. So when we're talking of the woman now, to be specific, there are different causes of infertility. If you look at the reproductive tract of the woman, any abnormality as it relates to the reproductive tract can lead to infertility, because that tract has to be intact before normal conception can take place.
Okay.
Yes. So if there is problem starting with the cervix, cervix is like the gate of the womb. They call it the mouth of the womb in layman. The mouth of the womb. Yes. If there is problem with the cervix, or if there is problem inside the womb, or if there is problem in the tubes that carry the eggs, speaking like a layman, and carry the eggs, and then if there is problem with the eggs or the ovary that produces the eggs, or if there is a problem with the abdomen, in the peritoneum where the ovaries reside. So problem in any of these parts of the reproductive tract of a woman can affect fertility.
Okay.
Yes.
All right, sir. Is there any risk factors or those people that this thing usually affects? Now, I'm talking about the age. Maybe there is a age that this thing really affects, or there is hormone imbalance. There is a lot of lifestyle too that is causing it.
Okay. When we talk of risk factors go along with the causes.
Okay.
Yes. Just like we said, there are different causes of infertility. So when it comes to the cervical problems, there is what we call cervical stenosis, meaning the cervix become more like closed. The gate of the womb is closed. And what usually causes cervical stenosis is usually infections. The PID we talk about can have cervicitis, which is infection at the mouth of the womb, which at the course of healing also it can become stenous.
Okay.
So what that means is infection is more of a risk factor. You get my point. There is also a problem that has to do with trauma to the cervix. For people that have traumatic abortions, or we call it illegal abortions, some of them have these abortions from people that use either substandard medical equipment, or they are not aware of how this thing should be done.
Done.
So, because of which they may injure the cervix. If it must heal, sometimes it heals with scarring and with some closing or fibrosis, we call it medically. Now, if you extend and go to the problem of the womb, inside the womb, you understand, you can have fibroids as a risk factor for infertility, because there are fibroids that grow inside the womb rather than outside. Then you can have infection inside the womb, endometritis, you understand. And then we can have other conditions too, which it may not be
Mention or
mentioned here, you understand,
yes.
for ease of our understanding. Then you can have problem with the tubes. Risk for PID, pelvic inflammatory diseases, can extend into the tubes. You understand, which can lead to what is called tubal blockage. Tubal blockage from infections. Particularly, there is an organism we call chlamydia.
What is the meaning, sir? Can you just say?
Chlamydia is a bacteria
Okay.
that, if present, usually affects the tube and leads to tubal blockage. You understand? So these are also, so what that means is, if I'm to summarize the risk factors, you understand, illegal abortions, pelvic or genital tract infections are risk factors, uterine fibroids, they are risk factors. Then we have other causes of infertility that relates to the environment. Exposure to environmental, this one affects almost everybody. Exposure, especially those people that work in certain parts where some of these chemicals are predominant. So when we talk about exposure to like lead, you understand, exposure to radiations, all of us are exposed to some degree of radiation in the
Yes.
environment. But those that work in environments where there is high radiations, you understand, they can have problem with fertility, either male or female. You understand? And those people that are exposed to, there are other lifestyle problems that we do have. Those people that are into smoking,
Okay.
to tobacco, then marijuana, and then alcoholism. All these factors, all these are associated with reduction in fertility, in either male or female. But you know, most of this lifestyle, especially when you talk about tobacco smoking, marijuana,
Some people say they are smoking like cocaine. They can take cocaine.
yes,
like a
all
woman.
those things are related to reduction in fertility. Then we have our own lifestyle, the way we live our lives, sedentary lifestyle, you understand, which may lead to obesity in a lot of people, and it may also lead to weight gain. Some of these things are known to cause reduction in ovulation. Ovulation is the release of the egg that should be fertilized. You understand? So when you talk of diet, you understand, and all those things have been related to reduce infertility. So if you are going to summarize the risk factors, if any of these things that I have mentioned can be termed as a risk factor and as well a cause indirectly of infertility in either male or female, as the case may be.
Okay. So, sir, you know, I've been hearing a lot of people. I just want you to buttress about the age. I don't know, maybe it's true. Because some people are likely said if you did not marry on time, or your age is passing, maybe your age is more than 30 years, you can be suffering from infertility. Is it true?
Yes, age is a risk factor for infertility in both male and in female. Now, according to statistics, now people there is a reduction of infertility about 10 to 15% in those that are within the age of 30, and then the percentage increased to about 30 to 40% in those that are at the age of 40. Then it goes as high as 80% in those that are above the age of 45 for both male and female. Because as a man ages, there is a reduction in sperm quality. And then some of these environmental factors we mentioned, they are likely to encounter you with age. You understand? So some of us that are now young, we interfered with the environment little compared to those people that are old.
Yes.
You understand? When you talk of the woman, there is what we call ovarian reserve. These eggs that are released, you understand, they are reserved, and they are not infinite. What that means is there is a time that they exhaust. You can exhaust the eggs, and as a woman ages, the quality of these eggs reduces. So that automatically will affect the chances
Of getting
of
pregnant.
either of them conceiving. So age is a major risk factor for infertility.
Thank you so much, sir. The last question I want you to, what are the prevention can somebody be doing for not to be having this infertility issue?
Okay. So largely, if we're going to talk about the prevention, yes, there is what we call level of prevention. Level of prevention is you prevent. There is primary, secondary, and tertiary level of prevention. Yes. So at primary level, you are trying to prevent something that has not yet occurred. So in that case, going by these causes that we have mentioned, we can say that for somebody that is normal or even before getting married, you understand, everybody wants to one day conceive. So avoiding or treating or avoiding exposure that will lead you to having infection, multiple sexual partners, is a risk factor for having genital tract infection. So avoid it if it is possible, or use protection as much as possible. That's number one. Number two, avoid radiations as much as possible. If you're working in places where there is so much radiation, avoid it. Avoid taking alcohol if it can be avoided. Avoid marijuana. Avoid tobacco. These are primary, even before they become a problem. Avoid them. You understand? But at the secondary level of prevention, we're talking about those people that are having problem with conceiving, or they are already exposed to some of these things that we talk about. So treating infection early. So what that means is, even for those that are having infections that are treated early is better than those that are treated late. So treating infections early, you understand, and then reducing for those that are already smoking. Already you're smoking, there is nothing you can do. Reducing smoking, reducing alcohol intake, you understand, exercising regularly, you understand. All these things can reduce. This is at the secondary level, you understand. But at the tertiary level is infertile couples, those that are already infertile. Another way of prevention is seeking medical advice as early as possible, so that if there are other reserves for men that are having low sperm quality and other things, the small sperm quality, the small sperm that can be preserved, at least if you present early, that one can be preserved. For women that are having low ovarian reserve, by the time you present early, some of the ovaries, you understand, can be used for treatment, you understand, rather than just staying like that until everything is gone. You understand? So these are the levels of prevention.
Thank you so much. We really appreciate you for coming on this program. I hope if I call you next time, you will answer me.
All right. Thank you so much for having me too.
Thank you. I really appreciate it. Hi guys, I know you guys have learned a lot of things in this topic. Please, if you have this issue, it's better you should go to the hospital, and also try to be treating yourself like infection. If you have infection, they said early to treat infection. It's better for you to treat it late. Please, and try to be following me on all social media. You can follow me on Facebook. You can follow me on TikTok. On Facebook, for at Fume Sheke. On TikTok at Fume_Sheke. Thank you so much. See you in my next video. Bye.